Horizontal chopping is really beneficial in these morgagnian cataracts. Now, because the nucleus is mobile, using this more physiological form of chopping is the best way to divide this nucleus. So I have a nice large capsular axis. The nucleus division process, I want to show it in slow motion. I would always want to create a small trench in the central part of the nucleus. This gives me access to the central core of the nucleus, wherein I can really get a good hold. The secret for chopping always is to get a good hold. The chop settings are longitudinal energy of 40%. It's in burst mode, and I'm going to use a burst of echo energy so that the tip gets buried into the substance of the nucleus. So I'm trying to show this in a magnified view. And how much of a tip has to be buried? Now this depends upon the density of the nucleus. In this case, the nucleus is very dense. So I'm going to use the power such a way that at least 90% of the entire length of the tip gets buried into the substance of the nucleus. This ensures adequate hold. And once the tip is buried, the horizontal chopper is placed exactly opposite to the phaco tip. It goes in and hooks the equator of the nucleus. To aid this, the nucleus is actually pushed towards me so that I can see the equator very well. And then once the equator is hooked by the chopper is then moved slowly towards the phaco tip. During this moment, the left hand has got an movement directed towards the phaco tip in a horizontal plane, whereas the tip, which is held by my right hand, the nucleus is actually held slightly towards the up and towards the right side. We can literally see that the surface of the nucleus is actually grazing against the capsular surface. Now, this movement is important simply because I want to be conscious that I'm not putting any pressure posteriorly, that is on the posterior capsule. The nucleus is literally held up and moved anteriorly. To know that the nucleus is moved anterior sufficiently, one clue is to always keep looking at the nucleus margin touching the anterior capsule. And once the scoring is done and when reached the center point, now the lateral separation maneuvers are being done. Because it's a dense nucleus, the lateral separation maneuvers have to be slightly larger than what ideally it should be, but never be too forceful. We are seeing a full thickness separation up to the midpoint. That should be fine. Release the nucleus, rotate the nucleus, and again the tip is to be buried into the substance of the nucleus. The chopper hooks the endonucleus and then the chopper is moved towards the tip of the nucleus. A couple of lateral separation maneuvers are required to ensure that the last few fibers of the posterior plate are separated.